Hello again, and welcome back. This training is intended to provide clarification on the vaccine ordering process. Providers must use NYSVFC to order publicly funded vaccine and to maintain vaccine inventory information. VFC providers can place new orders for non-flu vaccine every 30 days. Stockpiling vaccines is discouraged due to the risk of vaccine expiration and loss of inventory because of storage and handling issues. VFC providers must maintain complete and accurate data in NYSVFC. This includes reporting all doses administered within 14 days per public health law and maintaining public vaccine inventory. Orders may be reduced or denied if any of the above requirements are not met or if a provider's order exceeds their expected administration over the next 3 months. Providers who report all vaccine doses administered and who have low levels of vaccine wastage are much more likely to receive their orders without modification or delay. It should also be noted that your practice must be open to receive vaccine deliveries for at least one consecutive 4-hour window on a weekday, other than a Monday. An administrative user role in NYSVFC is required to place orders. If you do not have an administrative user role, you must contact the NYSVFC Help Desk at 1-866-389-0371. On the left side of the NYSVFC homepage under the inventory header, select Manage Orders to access your vaccine orders. Further NYSVFC user training is located on the resources document included with this training series. VFC staff reviews all orders to determine whether the order meets requirements. If you are out of compliance with the program, New York State VFC staff may contact you to request missing information and may deny your order. Held or denied orders will have a note indicating the issue with your order and corrective actions needed on your part. Your order may be held or denied if you have not submitted a complete provider agreement for the current year, your inventory appears incomplete, or if there are unreported temperature excursions. Your order may also be held, denied, or modified if the order exceeds more than 3 months of vaccine inventory in your practice. This assessment depends on your current inventory and average monthly doses administered, as reflected in NYSVFC. New York State VFC providers may order routine vaccines no more than once every 30 days. This does not apply to flu, COVID, and RSV vaccine products. Smaller providers may not find it necessary to order monthly. Special circumstances may be considered if a provider needs to order before 30 days has passed since the previous order. You can order enough vaccine for 2 months at a time, but your inventory should not exceed 3 months' supply at any given time. VFC staff may reduce your order if you have adequate inventory on hand. Orders can take up to 2 weeks to arrive, so plan your ordering in advance. Outstanding circumstances such as inclement weather may impact this time frame. Contact the New York State VFC program for guidance on calculating ordering amounts. Please use the order notes box to indicate any special circumstances. Vaccine deliveries depend on accurate delivery information, including delivery contact, address, delivery days and hours, and additional delivery instructions. Review your contact and delivery information before you order. Any updates to your contact and delivery information must be made in your provider agreement in NYSVFC. This will temporarily pause your ordering capabilities until VFC staff reviews and approves these changes. Vaccine cannot be delivered unless someone is available to accept the shipment. More information on accepting vaccine deliveries is covered in training number 12 of this series. Prior to placing a vaccine order, review your inventory. Your physical inventory should match your NYSVFC inventory. Discrepancies may indicate unaccepted orders or problems in decrementing administered doses or expired vaccine. Managing vaccine inventory is covered in training number 10 of this series. As previously indicated, your EMR may be on a delay. Per public health law, doses may be entered into NYSVFC up to 14 days after administration. Review your VFC report in NYSVFC. This shows your reported vaccine administration by VFC eligibility for vaccine type or trade name. The VFC report is covered in detail in the NYSVFC Advanced Reports Training webinar, which is linked on the resources document included with this training series. Run this report monthly to ensure that vaccine doses administered are recorded appropriately in NYSVFC. In some cases, data may not be transferring properly between NYSVFC and providers who exchange data via electronic medical record due to system upgrades or changes. If doses administered are not displaying properly, this can impact your vaccine order, and your order may be reduced. VFC staff use the NYSVFC VFC report and the provider's current inventory to estimate how many doses a provider may administer over the next 3 months. New York State VFC staff will not approve more than a provider's estimated 3-month administration needs. An order might be denied for the following reasons. You've placed an order less than 30 days ago. Wait until at least 30 days have passed since the last order to submit a new order. If the need for vaccine is urgent, resubmit the order with a note and call the VFC program at 1-800-543-7468. Your order may also be denied if doses administered data is incomplete or missing. VFC eligibility is required to be documented with each dose administered in NYSVFC. Patients with VFC unknown as their eligibility may cause vaccine orders to be held or denied. Proper EMR setup can help eliminate issues with VFC unknown eligibility. And contact the NYSVFC help desk for any assistance needed with data exchange errors. Your vaccine order may also be denied if your annual VFC provider recertification has not been received. It may also be denied if you have some other unresolved compliance or storage and handling related issue. You must resolve any compliance issues prior to resubmitting the order. The following are the order statuses in NYSVFC. Pending. Your order is submitted, but not yet under review. In progress means your order is under review by the VFC staff. Tentative approved means additional information is needed before VFC staff can approve the order. VFC staff will communicate with you and note on the order what information is needed. Final denied means the order has been denied because you have not supplied the required information for your order or your NYSVFC inventory indicates you have adequate vaccine inventory. You'll have to resubmit the order in NYSVFC when you have addressed any outstanding concerns. Final approved means the order has been approved by the VFC program and sent to the CDC to be fulfilled. Please alert appropriate staff that an order has been placed and should arrive within 2 weeks. Ship means the CDC has shipped the vaccine. Tracking information is available in NYSVFC. Once you have received the vaccine, verify the contents and accept the order in NYSVFC. And lastly, accepted means that you have accepted the order into NYSVFC, and the vaccine doses and specific information have been automatically added to the Manage Inventory module. Beginning in the 2025-2026 flu season, flu pre-booking will replace traditional flu ordering in NYSVFC. This module is expected to be available in NYSVFC prior to the start of the coming flu season, with more information to come. For RSV, place RSV orders separately from regular orders in the NYSVFC ordering module. The New York State VFC program receives specific allocations and/or ordering thresholds of RSV, often sporadically, and orders may be reduced until the full supply is received. The following are key messages from this training. Program compliance issues may result in delays or denials of vaccine orders. Doses administered need to be accurately recorded in NYSVFC. Public vaccine inventory must be accurate. Always confirm organization delivery contact information and hours. All orders must be placed using NYSVFC. There is a minimum interval of 30 days for the ordering of non-flu or RSV vaccines. And when ordering, ensure enough vaccine for at least 2 months, no more than 3. Thank you for your participation in this training on placing vaccine orders. As always, any questions can be sent to NYVFC@health.ny.gov.